Hospitals and insurers are robbing all of us.
100 million Americans drowning in medical debt.
When hospitals and insurers don't show us their prices, they charge us whatever they want.
I've been walking with my face turned to the sun.
American citizens in need of care, afraid to enter a hospital.
I do what I can when I can, while I can for my people. While the clouds roll back and the stars fill the night, that's when I'm gonna stand up, take my people with me. Together we are going to a brand new home.
We look to our elected officials in Congress
To put a stop to the overcharging.
Empower us with real prices and hold hospitals and insurance companies accountable.
We demand actual prices.
And true transparency in healthcare.
No woman, no cry.
For far too long, hospitals across this nation have profited from concealing their prices from patients.
No woman, no cry.
Not doctors and nurses, but big business, getting rich on hiding the truth from the sick.
Hey, little darling, don't shed no tear. No woman, no cry.
Our healthcare system is crushing the American dream
Good friends we have, and good friends we
by
got
robbing workers, employers, unions, and families.
along the way.
I remember opening up that first bill. It was just complete shock, and I was so hurt.
In this great future, you can't forget your
You
past.
choose what bills to pay, paying rent or paying the hospital.
So dry your tears.
You're focusing on, oh my God, how am I gonna eat? I'm gonna do anything.
There are laws on the books that mean prices are now a patient's right. But providers continued with a lack of transparency. We have the right to know healthcare costs up front.
When we can't see or compare prices, hospitals charge us whatever they want. They robbing us.
You're just going to do whatever they say just because it'll hopefully get you one step closer. So you get this bill that's insane.
For far too long, hospitals across this nation have profited from concealing prices from patients.
So we call on all our politicians, City Hall to Congress, and all the way up to President Biden, to enforce the existing rules for price transparency.
We need transparency in healthcare, and we demand it.
It's our health. It's our money.
Power to the patients.
Power to the patients.
Power to the patients.
Thank you. So we've got a lot of directions recently that are actually very actionable steps as opposed to this is the big picture. We've got the big picture, but we've also got actionable steps. And so the climate discussions have been a real call to action. We look forward to moving it forward and continuing our collaboration. The same needs to be said about healthcare, that we need actionable steps, real solutions. And our next speaker, Dr. Carolyn Mazure, is coming from Washington. She is the chair of the White House Women's Health Care Initiative, and is going to be telling you about some research that's going on. It's a very exciting time in terms of women's health care research. So Dr. Carolyn Mazure, please welcome her. Thank you.
So my thanks, first of all, to you, Jane, for inviting me today into the Sanders Institute. Can everybody hear me adequately in the back? Yes? Okay, great. Thank you. And I very much appreciate the warm welcome that I've received since I've been here. Today, I'd like to provide a brief snapshot of just some of the substance and the actions of the initiative that President Biden launched on November 13th, 2023. And the screen's coming down, so I'm going to pause for just 1 second. There, great, thank you. I'm not going to show you anything on the screen. I'm just going to talk with you. So the president launched this on November 13th, 2023. It's led by the First Lady, Dr. Jill Biden. We work in collaboration with the White House Gender Policy Council, and I am very honored to be the chair of the initiative. The goal of the initiative is to fundamentally change how we approach and fund women's health research. And this is because for far too long, women's health has been understudied and women's health research has been underfunded. It was only in the 1990s that the prevailing scientific tradition of generally excluding women from clinical trials as participants began to change. This change was based on the increased recognition that research conducted solely on men could not necessarily be applied to women. And as a result of excluding women, we were faced with a very significant knowledge gap in information for caring for women. Moreover, in the last 2 decades, we've had serious progress, no question. However, we still know too little about how to effectively prevent, diagnose, and treat a wide range of health conditions in women, leaving women and their healthcare providers without the tools that we all need to respond to conditions that, first of all, affect women uniquely. For example, endometriosis, especially impacting young women, fibroids, more common in Black women, preeclampsia, a cause of our country's high rate of maternal mortality, and debilitating symptoms of menopause that many women experience and lead to absence from work and inability to care for themselves properly. Conditions that affect women secondarily differently than men, so they may occur in both women and men, but they affect women differently, such as those found in heart disease, the greatest cause of mortality for women in our nation, and in complex and wide-ranging brain-based disorders such as epilepsy, stroke, multiple sclerosis, and many others. And thirdly, conditions that affect women disproportionately, ranging from Alzheimer's disease. 2/3 of the individuals who suffer from Alzheimer's disease in the United States are women, to migraine, to depression, one of the greatest causes of disability in women worldwide as well as nationally, and the wide array of autoimmune disorders that occur, whether we're talking about rheumatoid arthritis or thyroid disease. 80% of all autoimmune disorders occur in women. There's also the issue of chronic conditions, conditions that endure over a lifetime or long periods of time. These are more common in women. And multiple disorders occurring at the same time, also more common in women. And although we know that women tend to live longer than men, the estimates are that 20% more time is spent in poor health for women than men in our nation. So to pioneer the next generation of discoveries that will close these significant research gaps, the president, through the presidential memorandum that I mentioned he signed in November, first asked how can existing federal dollars work harder for women, and directed each member of the initiative, which includes the Department of Health and Human Services and all its multiple components, such as, most notably, the National Institutes of Health, but many others, Departments of Defense, Veterans Affairs, Agriculture, the Environmental Protection Agency, and the National Science Foundation. These are the members of the initiative. And he has asked these members to provide, as Jane would say, actionable recommendations for how they'll advance women's health research through policy and programmatic changes. As these agencies begin work on their recommendations, which they have done, and I'll return to this to tell you some of the outcomes, we began listening sessions, roundtables, and discussions to understand the health focus and concerns of many different stakeholders, including those seeking care, healthcare providers, advocacy groups, foundations, professional societies, and others from public and private sectors. And I would say that perhaps because of my own personal training, these really were listening sessions. We wanted to know what people thought was needed, what was absent, and what needed to be provided. And throughout all these experiences and discussions, we listened for opportunities for change. And among recurring themes, we heard about several major issues. First, the importance of recognizing differences among women and dealing with health disparities, including in clinical trial participation and retention in those trials, because that is a major factor as well. Increasing interdisciplinary collaborations that allow researchers to address complex health problems. We often work in science in more siloed ways, and we hear that across other areas that people are working on here today. And we recognize that in order to deal with that, we have to work together in science and address those health questions that are complex and can only be answered if multiple disciplines work together. For example, how is immune system dysfunction a common link across multiple disorders? Or how does a primary brain disorder, such as stroke, relate to other vascular disorders, such as preeclampsia and heart disease? Dr. Biden also heard that, despite advances that could provide women with improved care, it takes too long to translate research findings into the marketplace. Recognizing the value of this last recurring theme, and that we need to do more and move faster so that women see the results in their health and in their lives, 100 days from the signing of the presidential memorandum in February of this year, the First Lady announced ARPA-H's first ever Sprint for Women's Health and their commitment out of their budget of $100 million dedicated to transformative research and development in women's health. This new sprint, under the leadership of ARPA-H, which is part of DHHS, and it's the initial stand for Advanced Research Projects Agency for Health within HHS. Now you know why it's called ARPA-H. This new sprint will accelerate generation of discoveries. This is their expertise, this is their function. And they're going to move discoveries from early stage proofs of concept to products that are ready to be commercialized. They look at both ends of that spectrum, including home-based affordable products. And innovators have responded to ARPA-H in an unprecedented number of applications that are now being reviewed for funding, and announcements will be made within this year. And so we started by asking federal agencies and departments what they can do now to close the knowledge gap on women's health. We listened to the community writ large about treatments and prevention strategies they want and need. And we sought expertise to learn what science can do to make positive change. Importantly, I think that it's very useful to say as well that Dr. Biden spent a lot of time traveling the country and really seeking the perspective of research experts. And it was really since the initiative was launched that Dr. Jill Biden has been at the lead. And we've traveled from California to Illinois, to Georgia, to Massachusetts, to Colorado, visiting research institutions and speaking directly with women and innovators about their work and their goals. And so it really was in this process that I'm describing to you that we came to these three major areas or themes that I'm talking about with you today. And Dr. Biden's involvement has been invaluable. And so we sought these kinds of consultations, these listening sessions, these lab tours. We did all of this to move forward in an informed way. And during his State of the Union address, the president then called on Congress to make a transformative investment for women's health research based on what we learned. And it would serve two major functions. If we receive this money through Congress, first, it would establish what's called a central fund for women's health at the National Institutes of Health that would advance interdisciplinary research in women's health. Another of those three occurring themes, in addition to bringing products more rapidly to the public and to clinical care providers. And this central fund would promote different areas of science to work together to answer complex questions that could cut across NIH institutes, these more siloed, important but siloed areas of work, and don't explicitly fit into the way we typically structure research. So they would really employ the enormous bank of data, information, expertise that exists and help us work across all of those areas that do extraordinary work and have led to many, many discoveries. And now, as we'll begin working with Congress to secure these investments, we're also moving forward on actionable recommendations. And as I think about it, there's one other thing. I mentioned to you that there were two things that this money would accomplish. The first was the central fund that I just described, but the center is for innovation that could exist around the country is also a very important aspect to this. If this money were available, if these funds were available, then there also would be the creation of a nationwide network in many states across the nation that would focus on research centers of excellence and innovation in women's health. And they would also focus specifically on the translation of discoveries into clinical care. So, as I say, I wanted to keep you up to date on these actionable recommendations required by the presidential memorandum. And recently unveiled are more than 20 new actions and commitments that you can read about, certainly in greater depth, through the White House press room website. And these 20 new actions came from every federal agency that was named in the memorandum. And we have found great interest, great excitement across all of these members of the initiative. And I just give you two examples in the interest of time. The first is the National Institutes of Health has stepped forward, as always, to launch a new nationwide effort to close gaps in women's health research across the lifespan. So a focus more about the transitions and the lifespan of women. And that will be initially supported by $200 million from the NIH budget beginning in 2025. The National Science Foundation issued a call for research applications focused entirely on women's health topics for the very first time. These are changes, palpable and important changes. And these changes are occurring even as the president directs additional action within the government through his executive order on women's health research and innovation that he issued on March 18th, 2024, that directs the most comprehensive set of executive actions ever taken to advance research on women's health, and in which the president reiterates a commitment to the third recurring theme, namely that existing research gaps mean that we know far too little about women's health across women's lifespans, and those gaps are even more prominent for women of color, older women, and women with disabilities. Through this executive order, the president is directing the members of the initiative to do three things. First, integrate women's health research across the federal government research portfolio. That's such an important word, that word integrate. Not just add on, integrate it by ensuring common research and data standards that enhance the study of women's health. And not just the inclusion of women, but consideration of women's health in the development of study design, as well as in data collection and analysis, so we have outcomes specifically on women as well as men. Secondly, prioritize investments in women's health research with a focus on driving innovation, including through entities like ARPA-H, and also the Small Business Innovation Research Program that exists within the NIH. And third, galvanize new research on the understudied area of women's midlife by launching a comprehensive research agenda related to menopause and, equally important, disorders and conditions that often occur after menopause, like osteoporosis and heart attacks. Thank you. Or are more likely to be diagnosed after menopause, such as Alzheimer's disease. And fourth, because I did tell you there were four. No, I told you there were three by mistake. So. And the fourth, regularly assess unmet needs in women's health research by assessing gaps in federal funding and identify changes that are needed to support women's health research, which is now being done through collaborative efforts of the Office of Management and Budget and the Gender Policy Council. And there is more to come. To fully realize this opportunity, a word that I've heard here and is the right word, these are opportunities, as Jane said, calls to action and opportunities. We need to develop ways to work together across sectors and industries to ensure that all of us, government, research centers, advocacy organizations, foundations, philanthropy, and the private sector are doing everything we can to close research gaps in women's health and improve women's lives. And this will pay benefits, because as women's health improves, the health of the nation thrives. On that note, I want to take a step back from this snapshot that I have presented and speak to you for a moment about how meaningful this work is and how meaningful the First Lady's leadership is for the field of women's health research. As a clinician, a researcher, and the founder and director of the Women's Health Research Center at Yale University School of Medicine, my life's work really has been dedicated to improving women's health by improving the research that we do on conditions that uniquely, disproportionately, or differently impact women. And never before has there been such a comprehensive effort from the federal government to spur innovation in women's health and ensure that relevant federally funded health research works harder for women. This is an enormous opportunity for important positive change in ensuring that everyone can benefit from scientific innovation. And we are very excited about generating clinically relevant data on women that informs care and improving the lives of women, men, and families all across the country. And thanks to the First Lady's leadership, the initiative will continue taking action so that we have the answers we need when it comes to health. And with that, I thank all of you for the work you do and for caring about the health and lives of women. And now I would turn it back to Jane.